There is a famous saying that you can't go back and change the beginning, but you can start where you are and change the ending. When it comes to debilitating back pain, no words could be truer. When your back hurts, everything hurts. At FloSpine, we understand this and focus our efforts on providing the best technology available to help unlock your true potential. Meet the KeyLift, the first of its kind technology pioneered by FloSpine that was specifically designed to bridge the gap between failing spinal segments and nerve compromise. The KeyLift uses patented technology to dynamically wedge between the most stable parts of the spinous processes and create more space by lifting the narrowed parts of the spinal column that have collapsed, leading to nerve impingement. Once the delicate nerve pathways are decompressed, the KeyLift is then locked into place to stabilize the focal spinal segment and prevent it from recollapsing. Here you can see the active lift mechanism in action. The KeyLift comes in multiple sizes and configurations in order to address all lumbar and lumbosacral levels that can lead to lower back pain, regardless of each individual's unique anatomic and structural makeup. The KeyLift is able to provide 4 mm of decompression at each segment and can also be used as a fusion device to ensure long-term stability. The KeyLift is the first FDA-approved elevating interlaminal device that can lift, lock, and fuse the interlaminal segments, making it a unique and powerful treatment option in the right patient. Your KeyLift surgeon will be able to do a thorough exam of your back radiographically and clinically to determine if you're a good candidate for this groundbreaking approach. At FloSpine, we are dedicated to helping our surgeons achieve optimal outcomes which are solely aimed at elevating your true potential as a patient. With the KeyLift in our portfolio and superior results in mind, we've got your back. The surgery begins by positioning the patient in the prone position on the operating table following the induction of anesthesia. Once sterile drapes are placed, the surgeon will identify the planned surgical location by palpating the spinal processes and using intraoperative X-ray imaging. A 3 to 5 centimeter incision is made over this area and carefully deepened through the soft tissues and paraspinal musculature, thus exposing the adjacent spinous processes and lamina, and extended out to identify and expose the adjacent facet joints. Next, the surgical site is cleared of connective and soft tissues while lightly decorticating the adjacent spine segments and removing the interspinous ligament. Once this is complete, the appropriately sized rasp is utilized to remove excess bone and clear a pathway for the KeyLift implant. Using the provided sizing caliper, the tip of the caliper is placed between the spinal laminae and the caliper is squeezed to distract the laminae and measure the desired spacing. Using intraoperative fluoroscopy, the laminae are distracted until the spinal column is restored to the predetermined height as measured by the caliper. The height determines the appropriate size of the KeyLift implant, which may be seen on the caliper tool scale. The appropriately sized KeyLift implant is then placed on the KeyLift inserter and locked into place. If required, the wing crimper may be used to further open the wings to match the patient's specific thickness of the spinous processes. This step may not need to be performed, depending on each patient's sized anatomy. Under fluoroscopy, with the implant mounted on the insertion tool, a mallet is used to lightly tap the inserter to advance the KeyLift implant into the prepared interspinous space. The KeyLift's distal teeth should be inserted so that they are fully wedged between the superior and inferior laminae. Once the KeyLift is inserted to optimal position in all planes and confirmed by X-ray, insert the expansion driver into the KeyLift inserter. The expansion driver is then rotated to initiate the implant drive mechanism screw. As the screw rotates, the implant will expand as the expanding wedge moves towards the distal end of the implant. Once fully expanded, which is signaled by 2 tactile clicks and a positive stop, the expanded KeyLift implant will create a total of 4 mm of distraction between the superior and inferior lamina. Once fully engaged, the KeyLift placement and expansion is confirmed under fluoroscopic imaging. The KeyLift driver and inserter are then disengaged and removed, leaving the KeyLift in place. Next, use the crimping pliers to squeeze the KeyLift implant's wings at the superior and inferior locations. Crimp the KeyLift implant in a controlled manner until the teeth on the surface of each wing have engaged and penetrated the spinous process both superior and inferior to the implant. Visually and manually confirm that the implant is rigidly fixated to the bone. Obtain final AP and lateral fluoroscopic images to confirm that the implant is in a good position. To achieve fusion, bone graft is inserted into the graft cavity of the KeyLift and around the spinous processes. If fusing through the facets, the articular surfaces are decorticated and bone graft is placed optimally to aid the fusion. Finally, the KeyLift wings are secured with the KeyLift clamp installation over the implant using the provided instrumentation. Once alighted and compressed, the KeyLift clamp is locked in place. Next, the wound is closed and dressed according to the surgeon's preferences. FloSpine's KeyLift system represents a new generation of dynamic spinal column surgical implants that enable surgeons to expand their arsenal in the surgical treatment of minor and complex spinal conditions while elevating their patients' outcomes. At FloSpine, we've got your back.